You know, a lot of the patients that we serve, the primary care home, their health home is the first stop that they bring many of their problems. They bring lots of different issues to the primary care doctor and to our team here. And so, you know, a lot of times what we see, and especially in our population, we have a lot of minority populations where like mental health issues, they carry kind of a stigma. And so for them to bring those issues to us, you know, really says a lot. They trust us with those issues. And when we're working with them and, you know, recommending to them like, hey, we think that, you know, this may require this, or, you know, we think you need this intervention. You know, if we are then giving them a referral and then they hear that, okay, you won't be able to see this provider until, you know, 3 months, several weeks after, you know, you've presented this issue to your provider, you know, that does a lot for them emotionally. It may kind of just make them feel like I'll never get any relief, or again, like I was mentioning, they may be in a really difficult home situation. They may be experiencing the brink of failure in school or being put out in school, and this critical piece of intervention, you know, we know medication doesn't solve everything, but it can be a life-changing intervention to address symptoms that might be impairing the child's functioning. And so to have to wait long periods of time for that, it can do a lot of more emotional stress to the family, to that child, just, you know, waiting, you know, not knowing necessarily, you know, when they might be able to get that intervention that we feel might be really useful for them. So for us to be able to utilize MO-CPAP to get recommendations regarding medicine or what we can do to adjust medications and things of that nature, it's really helping the whole system. We're averting a crisis a lot of times by being able to call up MO-CPAP and get those needed recommendations.